It's rumor.
It's prepping the live stream. We'll be ready to go when we start here.
Okay. Amber, how are you?
Good. How are
Good.
you?
Oh, good. Jeff, can you hear us all right? I don't think I've heard your voice.
I can.
Yep.
I can hear.
Good
I'm
deal.
just trying to hover over all the stuff I've got written down. I don't know
Okay.
what. Try to pull
Yeah.
something from a note from here, there, or one time or another. I've been writing them down.
Uh-huh. Yeah, I feel you. I typically keep my desktop like very clean. I'm kind of a neat freak about that, but I have more posted notes and such right now than I've probably ever had. So I feel you.
I can't
Oh,
remember everything like I used to, or close to what I used to. So if it comes across me now, I write it down. Try to.
Dave, are you good on the agenda? I know you don't have a hard copy this time around, but it's obviously very simple. Okay.
If not, somebody will correct me.
Yeah. Okay. Yeah.
I have six lines.
Yeah, you're good. Yep. Yeah, and that's what we should have. Yeah, because we pulled out the 7th. Yeah.
Right.
Yeah. And thanks guys for coming together in such short notice. Obviously would have loved to have done this, you know, at a regular meeting or whatever, but this is clearly a really sensitive time issue. I know Dave, I think you missed a fishing trip for this, didn't you?
Yeah, I was supposed to be on Buckeye Lake.
Well, you gonna get out there today?
That does make me feel better though, Dave. That Buckeye Lake.
Well, I got time. I can probably go tomorrow.
There you go.
All right, it's noon. You're ready.
Then let me start here, guys. Do we have Angie yet?
It sounds like she's getting set up in the conference room next to me, so she's not on though.
All right. Well, Ryan, in worst case scenario, if she's not able to log in, then you'll do your report first, and then I'll have you go get her, and she can come do that in your area. Okay. All right. I'm recording.
Okay, are we ready?
Mm-hmm.
Okay, I'd like to call the order of an emergency meeting for the Hamilton Local School District. Call the roll.
Mr. Obert,
Present.
Mr. Sewell,
Present.
Mr. Dahmer,
Present.
Mrs. Clark,
Yes.
and Mr. Shooty.
Present. Will you stand for the Pledge of Allegiance? I pledge allegiance
To the flag
of the United
of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Okay, so I need a motion to adopt the agenda.
So moved.
Second.
Any questions or comments? Hearing none, call the roll.
Mr. Obert,
Yes.
Mr. Sewell,
Yes.
Mr. Dahmer,
Yes.
Mrs. Clark,
Yes.
and Mr. Shooty.
Yes. We have no public participation that we know of.
Correct, we have none.
Okay, I need a motion for 4.1 educational. Actually, we'd like for Adam to read that motion. Or
Okay, yep.
that section, would you please?
Yes, I'll read the motion and the content. Motion is 2020-21 extracurricular participation. And then the content is approve students to participate and compete in extracurricular activities per the governor's order and the Ohio High School Athletic Association guidelines. Furthermore, the board authorizes Superintendent Mark Tyler during periods when the board is not in session to make decisions as to student participation and competition as circumstances dictate. And that is it.
Okay, thank you. I need a motion.
I have to make a motion.
I'll second that.
Any questions or comments?
Yes. So before we are to vote on this motion, are we going to hear the presentations or are
Yes.
we?
Yes, this will be part of it. We'll have Mr. Tyler give us the presentations of the reason.
Yeah, I can go ahead and start with that. Yes. So obviously, listen, everybody heard, the governor's press conference yesterday. We've been awaiting that for some time because of, when that press conference was, if this happened last week or the week before or something, we could have maybe offered a longer gap. We could have given more notice, I guess. We're really in a situation right now when it relates to athletics that it's a very time sensitive issue. We're going to need to really make a decision now, or it's going to put us in a situation where the teams that we are due to participate against us are going to look for other options to play. So we're going to lose those opportunities. So yesterday collected a lot of information, obviously, from the governor's press conference, and then had a post-conference call with the governor himself, Governor Husted Governor DeWine, Lieutenant Governor Husted had a call with superintendents. It was a really nice situation. We were able to ask questions and such. And then he later in the evening had that same call with athletic directors. So Ryan was able to participate in that. Bottom line, yesterday, I'm sure I know all of you are aware that he gave approval for schools, if they choose to move forward with athletic participation. You heard all of those things. Then later in the call, he had expressed to us, and really there were two kind of points in there that were very particular to me, two things that were real big decision-making factors. And that's why I'm asking Ryan and Mayor Kirk to come on and speak today. One of the first things that he brought up was really in response to a question was, what do we do if our local health department has issued guidance to the contrary or whatever? And the governor was very clear about that issue. He said, you should treat that as a singular data point. Treat the health department recommendation as a singular data point, and then use the preponderance of evidence. Look at everything else and weigh that as an equal part to everything else that you're seeing. And he was very clear about, that doesn't have to be, your deciding factor. It's, well, the health department said, and that's what you do. He said, look at that as a singular data point and weigh that amongst everything else. The second thing that he said, and actually Lieutenant Governor Husted, I don't know if he did this during your call, Ryan, but he actually kind of chimed in and said, hey, I want to reiterate that. That's a very important point. The other thing that they very much encouraged us to do was to drill down on our county data. They said, don't just make a decision on what it looks like in your county, really drill down and take a look at what it looks like in your local geography. So that's something we've been trying to accomplish for a while, actually. In conversation with Mayor Kirk, they've accomplished that over at the Village Obed. So I'm going to have her present that data here in a moment. But I think at this point, we'll go ahead and begin with Ryan. Ryan's going to do a presentation on just basically what we know at this point. Here's the other unfortunate thing, guys, is the health order will come out to us soon. We do not yet have the governor's health order. I would love to put that in your hands at this point and be able to do that. We don't actually have that in hand. Now, he did go over with us last night on our conference call. He told us, these are the things that you will see as a part of that order. Ryan, of course, is on the OHSAA board of directors right now, so he's very familiar with the things that are being discussed there right now. And then a lot of this is being discussed at our league level as well. So with respect to the health order, we could never do anything, nor could our league do anything that would be of a lower bar than what the health order would dictate, but our athletic league could choose to make certain things of a higher bar. And there are some of those discussions happening currently. But anyhow, bottom line, I'm going to have Ryan present on, what we know at this moment, the things that we know about practice, the things that we know about participation, and et cetera. And then we're going to have Mayor Kirk talk a little bit about the numbers that we have here in our local geography. So let's go ahead and turn it over to Ryan.
Thank you, Mr. Tyler. Just an update. I'm going to go through some of the things that we've done here, what our coaches have done, what our athletes have done, and some precautions that we already have in place even prior to the governor speaking yesterday. Our coaches and athletes have been taking necessary precautions this summer to ensure that safety is a priority. We have had 0 athletes this summer who have tested positive since we returned to workouts in June. Coaches and athletes not participating in drills are required to wear masks. Each coach and athlete is required to complete a symptom check prior to attending any team activity. This includes temperature checks and symptom checks, and if they've been in contact with somebody with COVID. We've also followed the governor's travel advisory. So if somebody's traveled to a state, one of our athletes or coaches, they are to quarantine for 14 days if it's one of the states on his list. Our coaches have also taken the time to address our athletes and let them know that what they do outside of practice and when they're with us is also important to kind of stop the spread of the virus in our community. I have a form that I've created that we will send to every visiting school that they will sign off on, saying that what we're having our kids do with the tests and the temperature, things like that, they've also done with theirs prior to bringing them here. As Mark said, we're awaiting that order. Within that order, there's a lot of indication that there's going to be limitations on spectators. We don't know what that number is, but obviously we'll follow that. Part of that's probably going to be, from what I hear on the OHSAA side of things, is that everybody will be required to wear a mask if they're a spectator. We're also going to start shifting towards working with Mr. Collier's office there on doing some online ticketing options to limit exchanging money, exchanging paper tickets. And we've got a pretty good program set up there where they just will get like a QR code on their phone, or they can print it out and then we scan it with one of our district iPads. As Mark said, we're going to meet as a league once we have this order, hopefully later this week, as soon as tomorrow, to decide some other things that we're going to do. For one example, the order might not say this, but we've talked about not allowing visiting bands to travel, to limit some of the spectator things like that.
Actually, Ryan, if I could chime in on that, I think our governor did speak to that, at least in my call, and alluded to the fact that there won't be visiting bands as part of the order.
Okay.
So.
I did not hear that on mine.
Yep.
But the other thing that the last thing I have is just that we're going to highly encourage, I'm sure some of you who've had student athletes in our district in the past know that we have travel releases as an option for families to transport their own students. So we're going to push that a little bit more to kind of cut down on who would be on our buses and things like that. And that way they can stay with their family. But in a nutshell, that's kind of what we've been doing. Like I said, we've been at it since June, since we got the okay to return to activities, and it's pretty much normal procedure now. Every day we're doing these things.
Okay.
That's all I have.
Yep, Ryan, appreciate that. And then I want to have Mayor Kirk now chime in on what we learned from her yesterday on the numbers here in our school district.
Can I ask a question for Brian real quick?
Oh, sure.
Oh, what was I gonna ask? Sorry. Has there been any discussion, or have you heard anything about whether or not there'll be any requirement to for testing before competing or anything like that?
Initially, that was in an order, but Mark, I believe you said that, and they said on our call that they didn't realize that the testing in the order that was for the TBT basketball tournament at Nationwide was kind of misguided and misplaced and just created a bunch of confusion. If that is in the order, I don't know how schools will do it. So it's my understanding through contacts with OHSAA that when they put that order out, the testing will not be part of it.
Yeah, the governor spoke to that in our call yesterday. He actually said, look, our bad, kind of, it did create some confusion that was it was not intended to be directed at high school athletes, but it was interpreted that way. So there's been this feeling that, there's been a lot of anxiety amongst, schools like ourselves. How are we going to test these kids, et cetera? And he came out clean in my call yesterday and said that is not a requirement. It was never intended to be a requirement.
What about if not testing before competing, if there's any exposure, is there a plan or a discussion about a plan or guidelines for that?
Definitely some discussion there, Amber, as far as can we require a test and stuff if a student's symptomatic, or things that we're still kind of awaiting with the order. But the one thing that was addressed cleanly last night, and honestly, this is one of those situations, in absent of the governor putting this in the order, I would have chose to do this as part of, our district protocols as well. If we do have a student who tests positive, we would not allow that student to return until they've had a clean bill of health from their physician, including obviously inspections of the heart, whatever test that would involve, if it's an EKG or whatever it would be, to roll out the possibility of myocarditis and such. So he did speak to that last night in the meeting, that will be part of the order. I would have made that part of our order anyhow. So yes. And then,
One more question.
Yeah, sure.
Sorry, were you going to say more about that?
No.
I was just, I had looked at the frequently asked questions or guidelines that OHSAA had released maybe yesterday or today. And it mentioned that the decision to go forward from their perspective was based on surveys to superintendents, school districts, but didn't really mention anything about using any science or like health information. Is it then to each district to like look at their local health department or local information? And so that's why they're only looking, because I was just surprised that they didn't talk about any use of science or data or health information to make their recommendation, and only basing it on what the superintendents and school districts wanted as far as starting now and moving forward.
He did have a doctor speak, and I believe it was the same doctor. We couldn't actually see their face, but I think it was the same doctor who spoke yesterday on the call. So we did, or on the on his broadcast. There was a doctor that spoke as part of ours and really spoke on the myocarditis factor. With all things related to COVID, the governor's position is that it should always be a local decision, and that schools should look at, their local communities to make those decisions, because the spread isn't equal throughout the state, et cetera, et cetera. So that should be a local choice kind of thing. As far as the decision to move forward, I think there were many of factors. Ryan might be able to speak to this more, but I think there were a number of factors with that. Ryan, you want to chime in on that piece?
I don't know why specifically there wasn't any science listed in the guidance. I have like the return to play document here, in the very first paragraph, it talks about in conjunction with their, I believe it's the Ohio Joint Advisory Committee on Sports Medicine. So they've had doctors in their conversations before they put out any of these recommendations.
Ryan, I'd also like to ask you, could you comment on what your conversations are with other athletic directors and such? What's it look like around our area right now?
It's my understanding from the information I can gather that everybody in our league is full go back. I would say 98% of the schools in Franklin County are, and this was as of yesterday morning, so that may change today. I know some schools that were kind of not full back also have board meetings today where they're going to discuss getting back to go full go. But yeah, from my understanding, I mean, don't always believe what you see on Twitter type thing or conversations you've had, but people are back and doing full go activities.
I like to say one thing. When I was watching the report yesterday, from my understanding from the lieutenant governor, if the guidelines aren't followed thoroughly, the team will be forfeited. And if that would happen, that would have a lot of consequences down the road. I would believe that if it wasn't followed and safety wasn't maintained, there should be and would be consequences for any coach that didn't enforce the safety requirements thoroughly.
And to chime in on that, I mean, yes, of course, we're going to have that expectation of our coaches with practices and such. The other piece to this, obviously, is in our competitions. So it's going to be one of those things. We'll obviously make this very clear to our community when we have our competitions that it's not going to be normal. This is not going to be a normal athletic season. It's just that simple. Participation, we know participation is going to be drastically limited. We don't know the specifics around it, but listen, it's going to be a fraction of what we previously had. Likely to be able to come to one of our athletic events, you're going to have to be a participant or a close family member or something like that to one of the participants. We're looking at it probably being a scenario where it's the participant plus a number, whatever that might be. Maybe that number's 2, maybe that number's 4. We don't have that detailed information yet, but there are going to be social distancing requirements. He absolutely spoke directly to masks yesterday. Even in our outdoor activities and such, he's going to insist that masks be a part of it. So for Ryan and I, one of the big things is the adherence to that amongst our spectators, and having people have the understanding that, look, we're providing this opportunity to our students. We're trying to provide the opportunity for families to be able to watch their children participate, or, their extended family participate, whatever the case is, but you're going to have to do it within our guidelines. We'll have a lot of discussions around those things, but just understand it's, we always have high expectations at our athletic events for conduct and et cetera, but this will be one of those situations that, there's an extra level of scrutiny. If that conduct's not adhered to, we'll have to, potentially remove folks or potentially remove spectators completely in order to let our kids participate. So people are going to have to adhere to the rules.
All
Right.
right, Mark, to that point too, we have, as part of their online ticketing, they will have to check off or sign off a spectator agreement form, where it's also going to have some of those same things. You didn't have a temperature, you didn't have any of these symptoms, you weren't out of state. So that'll be added to that format. So before they can go in and purchase a ticket, they're saying they understand these guidelines, wearing a mask, being in your seat, one-way traffic, things like that. So that'll be there for the community and the spectators to see as well.
Okay.
Well,
Okay.
didn't he also say that they'd have inspectors, basically inspectors, and help us correct anything that we misinterpreted or not quite doing right in the beginning?
Correct. Mm-hmm. Yep.
Mr. Fitzgerald, I was wondering, I know you're in constant conversation with the other athletic directors in the Mid-State League. I know, what is protocol going to be for that? Like, are you guys going to set something up to maybe give us a report of their school district and their area before we would participate that week? Is there something like set in place with that for the Mid-State League yet?
We don't have that in place, but that's something certainly we've discussed. Obviously that is a concern if you're traveling to Logan Elm and they've had an uptick. The only thing I see is that we've been updating each other on how many positive cases we've had within our programs. And I think only one school in our league, in our division, I'd have to pull it up here, has had 1 case all summer. So little things like that, but definitely we'll have to look at that data and make sure we're not putting kids in danger by traveling to an away competition.
Yeah. And listen, Jeff, the same would go for us as well. Listen, I certainly cannot guarantee, nobody can guarantee that there won't be contests that we'll have to miss. As a matter of fact, it's probably likely at some point that, somebody is going to have an outbreak and maybe a portion of their team is not able to participate, or maybe the entire team is quarantined. I mean, those things can happen. So it could be a situation we're preparing to, play an opponent and, find out the day before, or even the day of, that event's going to be canceled. And it's just one of those things. Again, I hate to keep saying this. I'm tired of saying, I think people are tired of hearing it, but the idea of fluid and flexible isn't just this cute term we use. Like we've never had a moving target like this ever. So it's one of those things. And that's part of what Adam read there a moment ago with giving me the ability to make these kind of decisions in between meetings. Listen, if I don't feel a situation safe for us to go to, I'm just going to pull the plug. Like, we don't have to have a meeting to say that we're not going to go. I'm just not going to go, or tell people they can't come here, whatever the case might be. So yeah, I mean, that's definitely a factor in this.
And another question, Mr. Fitzgerald, for the tickets, do you think that we would do all of those that way, or would there be an interaction of, I know best case scenario, we'd like to have it that way. Probably.
I think we'll do it all. If we can, we'll try to do it all, because how it'll work through our system is if player A gets 4 tickets, they'll have a code that they can use. And once that player A has used their 4 tickets, they can't buy anymore.
Okay, so each player then therefore and that'll be probably information be given to the coaches and then to you probably as the week goes along.
I believe I just have to give the ticket company the number and they'll send it out. So.
Okay.
And we've also talked about as a league, and again, nothing's official because we haven't met yet, but of just doing like a flat ticket fee for the schools that do not have the capability to go online with their tickets, a flat ticket fee for all events, all levels is $5. So that'll help the exchange. If there were money to exchange, you know, you're not sitting there making change for 20 out of a $6 bill. You're literally just handing a 5. So our goal is to not have to do that, but I could see instances where that would be wanted.
Yeah. If there are no more questions for Ryan at this moment, we'll move on to Angie. And again, obviously you can continue to ask questions here before we vote, but Angie, if you want to go ahead and present the village numbers, probably be a good time.
Okay. Good afternoon, board members, Superintendent Tyler, and any community members that may be listening. I was asked to present some data here. Now, we've been monitoring the situation closely throughout the village of Obetz, as well as the school district, which sits in Obetz. So that would make us, absolutely take a look at that data. I receive a daily report from the health departments, which contain the positive COVID cases listed by zip code. This came to me as a result of working with Congressman Stivers and Congresswoman Beatty after explaining the need to protect our community and first responders while they were engaging with our public. These reports have allowed us to use the data to see the cases directly affecting our community. We use a GIS system, which allows us to take the information and pinpoint the cases in our village as a whole, and also allows us to get a full and accurate picture of how many cases are actually within our school district. Using the standard 14-day model, which we've all heard as in regards to those under suspicion or under isolation. I pulled data from August 3rd to the 17th, which is the last 14-day period. Franklin County had reported 6 new cases in that 14-day period, in which none were students in the district. I also pulled Columbus Public Health. They had reported a total of 8 cases, in which none are students as well. The information does include minors that have tested positive. I have none of those minors on that list. I have looked at the addresses and the reports and checked them against our district data, as well as double checked them with the county auditor's website to make sure that those households were truly within our district. Because we're using the 14-day marker, some of these cases could also be removed probably by Friday or Monday at the latest. The system that we use gives us the ability to get the clear picture of the district, which allows us to break down the zip codes instead of using just the 43207 zip code, which is a huge area. This is not a true reflection of the southern edge of Franklin County where we sit, as we've noticed that within our own village. The governor, as he mentioned yesterday he said that we should be using more than one source to get accurate information as it pertains to each district specifically, to get a clear view of the activity in our district. And that is what we've done by using this information and mapping through our village system. We're continuing to see the numbers decline over the last several weeks in our district, as well as the county as a whole. So I just want to let you guys know, I've been getting this information for quite a while. So I, along with my administration and our team with the Village of Obetz, will continue to monitor the numbers daily and continue to work with our state leaders and our county health departments to make sure that we are given any and all information and data that concerns our village and our school district. And those, like I said, that information comes from Franklin County Health Department, which is where you guys have been getting your orders or getting your recommendations from. So that's all I have. I'll take any questions if you have them and try to answer them the best I can. Thank you for your time.
Okay, any
One
questions?
question I had-
Randy?
Oh, go ahead, Dave. I'm sorry.
No, I'm just asking, if you have a question, now's the time. Go ahead.
You're going to continue to monitor this throughout the epidemic, right?
Yeah, we've
This is
actually,
the last 2 weeks. This is something that's going to be ongoing.
well, yes, Mr. Ober. So I've gotten this information. Like I said, I had worked with the congressman and Congresswoman Beatty in early April to get this in, and it actually became an order by the previous administration, Dr. Acton, that she'd put in that all of our first responders and our villages were able to get this information to help protect those first responders. And my thought in that when asking and begging for that information was not solely for the purpose of my police officers, but also with our neighboring fire departments and the school district, because I have a vested interest here as well, as you know, I work here. So I've been monitoring and and we pull this, I get a report daily. So we look at that with my administrator and with my engineer, and we incorporate that information into our GIS system and overlap that into a mapping system, which will pinpoint. So I actually get addresses, names, the zip codes, all of that. As you know, we don't have just 43207, but 43207, as I had explained to the congressman and congress lady, 43207 expands so much further out than what is a true picture of our actual very tip of southern Franklin County, which I was pleased to see the governor say that, you know, go ahead and use the other sources I have, because I can tell you that with this information that we've been collecting since, like I said, mid-April, this has been something I've been able to use daily to gauge the cases in my own community, because I need to make sure, not just for the safety of my officers, but also for the safety of our community members. So I do have access to this, and I'm able, as long as they continue to incorporate that, and I think they will do it throughout this pandemic until something completely falls off, that they'll continue to send that information to me as the mayor. And I can have those pulled up at any time. We'll use that with Franklin County. I also incorporate Columbus's numbers as well, because of the different zip codes that we have. So this is something that Mr. Tyler can contact me with at any time, and I will have that information ready if it's needed.
Thank you.
You're welcome.
Okay, any other questions for Angie?
Yes, just one second, please. Let me get to my right page here. All right. I was wondering if you had any information on positivity rate for the data that you have.
I can actually chime in on that. So that was addressed yesterday in my Franklin County call, and that's, for me, really probably the most positive indication we got yesterday. So we had been previously told that, you know, the goal of Franklin County was to try to get under 10 and ideally closer to 5 as a positivity rate. Last week we're at just over or just under 12. It was right about 12 was the number last week. We were told yesterday that current number is 5.3. So that was a real positive indication that we got from the health department yesterday.
And so the 5.3, is that just from like last week's test? How does that part work? Is that what your understanding was?
Okay.
I don't understand.
Not completely sure of that, but they painted that as a very rosy picture. Like, this is probably the best indication we've had in a long time. The number of 5.3. What's pulling, you know, what
Where
that is
they're
reference
pulling that
to?
from,
Yeah. But they were very excited over that number, is the best I can explain.
Right. And I use the marker, Amber, just to kind of give you an idea. I use the marker of the 14 days because once a case goes on, the Franklin County and Columbus Health Department has used that 14 days as a marker for the cases for the under suspicion, which is you would go into isolation if they do the contact tracing. So the 14 days. So that's why I went back to the beginning of that 14 days, which is the model that we've been told to use, which would give you an accurate picture of how they were quarantining or how they were doing the under isolation. And some of these cases also fall off because initially some family members would test at different times. So you would have, like, let's say you would have 4 people stay on in that household, and then 3 of them would drop off and the other one would stay because they got tested at a later date or didn't have onset of symptoms. So we use the 14-day model because that's what's been suggested to us by both health departments.
Okay, any other questions for Angie?
Yeah, Angie, so you have the 43207 outlier, right? Is that correct? And then you can see where our district cuts into that 43207. Do you know where we're at as far as, I lost her audio.
You're on mute there, Angie. Sorry.
Sorry, go ahead, Jeff. Yes, 43207 and?
Yeah, and I was wondering, I know, like you said, it's broad, obviously outside of our district, a lot of it. Do you see the breakdown between the portion that's not in our district as opposed to where we're at and below the 07 area on out into other portions of our district?
I can see our district. I can see the city of Columbus and Worthington. Once you get into, because those are our reporting agencies for our district, because it's Franklin County. We have a few other zip codes, which I incorporated into this report as well. So we'll get Lockbourne, Shadesville, all the kids out at the base. Basically, it overlays every kid that attends and every residence in our district. But I don't get the other counties because, look, they've given us a pass on HIPAA law stuff. I can't give you guys names and addresses because I'm not going to violate that because I'm not going to, because then my information goes away. But I don't get the other counties. I'm not sure if the other mayors in the other towns, let's say Amanda has a mayor. I don't know if she's getting those informations from her county health department or not. This is something that I tried to champion and take on because I knew how important it was for our community. So I did get, I don't know if the governor, when Amy Acton put that order out, it was for the Franklin County and the Columbus Public Health. I don't know how that transferred over into those other counties such as Fairfield or Logan and those. So I don't know that. All I know is I can see the outlying areas of Grove City. I can see everywhere from Columbus to Worthington, all through Franklin County. I cannot see into the next county. That's not information that I'm privy to because there is no need for me to have that as a mayor, if that makes sense.
Trying to see how we stacked up on this lower portion of our county, and you stated very well. Am I correct? As opposed to other portions that if you move further into Columbus, and it's probably
yeah, because you're looking at what, 500,000 people, just a wild guess. You're looking at 500,000 people, and as we move further south to the rural areas, I can tell you through this whole pandemic that we've had cases, of course, but I can tell you as OBETS in the district as a whole that we have fared very, very well against our neighboring communities, be that Grove City, the reason that I was so upset about just the 43207 was because, like I said, you're getting from here almost to Children's Hospital all the way over, High Street. I didn't feel like that was a good representation. So that's why we wanted to dwindle it down. And we had spoke yesterday. So what we did basically was take our school district and treat it as if it was our own county so that we could get actual factual numbers, which was a good way to look at that. Thank you, Mr. Tyler. We did that to make it as if it was our own count, just so we could see what our true numbers were. We can compare them to Columbus. We can compare them to, Worthington, Franklin County as a whole. Their numbers have been going down, but to take and separate us off, which I think is the right thing to do to get a clear picture of who we truly are on the southernmost end of Franklin County, makes more sense to me to get that picture of what do we have compared to the whole city of Grove City. We can do those things. I just can't cross the line. So I can tell you that we have been through this whole pandemic. We have fared very well in this community, in our school district. I think people took things very serious, and I think they're continuing. I mean, you're going to always have those who, fight the man, fight the power, but I think people generally are just tired of being in this. And I think a lot of people are trying to make sure they're doing the right thing throughout the community to be able to move forward. So probably more than you wanted to hear, but there it is.
No, thank you. So I don't have any more questions for you, but I really appreciate, I know that I assume you probably put a lot of time into looking into that. And I really appreciate you giving us that perspective. So thank you.
Awesome.
Thank you. And Amber, just to you too, like I said, if Mr. Tyler or anyone is interested as a collective body, I can pull those numbers again at any time, and I have no problem doing that. I look at them daily because it makes sense for me as the mayor to look at those daily. And if I were to see, 25 to 50, if there's, if that takes a huge uptick, that's something I definitely will get a hold of Mr. Tyler to make him aware of, because that's important for all of us.
I just have one thing to note also. We got our from Aetna who has insurance for the schools. So every one of our employees that has Aetna insurance, we get a report every so often, and we have it through July. And we've had 50 just tests done, and we have just one confirmed case. So that would be employees of ours, their spouses, and all their dependents. From the very beginning of this until the end of July, we've had 50 tests done and just one positive, and we know who that was, and that was 6 or 8 weeks ago. So I just want to give you that information too, because I got that information 2 days ago. So
thanks, Adam.
Adam, approximately what percentage of district employees utilize the
About
health.
75%.
The only question I have, Angie, is what's the possibility of a daily report going to our superintendent automatically? So,
I can, well, Wally, I appreciate that question, and it is a good question. I cannot do a daily report to him because what I do is I will watch them daily. And if, let's say we get, 150 cases here in the village, that I will make that contact immediately. I can't do a daily report to him automatically because what I have to do is I have to export and import this data into my program. So it will take me a little while to get that together. So I can't do it daily, but I would be willing to, look at you weekly or bi-weekly, or if you're, if we start seeing things even in Franklin County, because this is just one piece of information, which I feel is the most important piece of information because it's a true picture of who we are. So if we start seeing upticks throughout Franklin County, and those look like they're going to be a lot higher, I get that report. So I can tell you that if I look on, let's say I look at Mondays, because they're always a day behind. If I look at Mondays and I end up seeing like 40 new cases just in our school district, I will report that to Mark Tyler. I will let him know if we are looking like we're seeing an outbreak, because that doesn't do anything for any of us if we don't have the information. And I feel like there's just kind of been a breakdown in that from everyone. So I do, when I'm here at work, I have my engineer who imports that into our GIS system. If there looks like there's a big uptick, my administrator will call me and say, hey, we've got, 3 new cases in the village of Obed. So I have a way to make sure that he's given that information, especially if we look like we're on the uptick. And I will tell you, I'll make sure I give the report if we're on the downhill slide too, because I think that's important. But as of yesterday, I know throughout Franklin County, we had about 87,000 that were actually recovered out of the whole Franklin County piece. So I thought that was a good number to have too. But at any time that Mr. Tyler, if you or Mr. Fitzgerald need that information from me, I have no problem gathering that for you. But I will, Wally, I promise you this, I will stay in that loop so that if we do start seeing rises in cases here in our district, I will make sure that they are aware of that.
yeah, I mean, down the road, we are an educational business, and getting the children back into the buildings is our utmost effort.
Right. And I absolutely agree with that. And I think everyone here agrees that we want to try to get these kids back in as soon as we can. And I think you guys will probably start working on that, because that's not my decision. That's something you guys will decide hopefully soon, and people will be able to make those decisions for their families. And I would appreciate if we could get back into school and people feel safe. So I understand that, Mr. Grover. Thank you.
I think, a weekly report to the superintendent till this thing is over, if that would be possible, because after the kids re-enter the building, the more information we have, the better decisions we can make.
Right. And I completely agree with that. So I will monitor that stuff then, Mr. Tyler, on a weekly basis for you, if that's what Mr. Robert would like us to do. It's going to be a 14-day span of how we do that. I mean, I get it daily, but if I see 40 cases come up overnight, I'm going to definitely be like, hey, we may have an issue here. So we'll do that as a weekly, but it will be, understand that when that report comes out, it will be a 14-day snapshot, right, if that makes sense to you, because we want to continue to use the markers set up, and given to us by the health department.
And, we're also getting that information from other sources as well. We get it through county meetings. We get it through the governor's announcements on TV like everybody else sees, but then we also have our individual county meetings and such. And, so we're able to see this stuff countywide on a fairly close to daily basis. But yeah, it definitely helps to have that local picture, I think, more than anything. So rest assured, I'm going to be asking you every single time I walk by your desk. So yeah, I mean, that's, no, we have a easy path here to stay on pretty consistent communication. That's good. Right. Thank you.
Okay, Mark. So we are preparing our families for a completely virtual start. And I'm not suggesting that we alter this or go to hybrid at this moment, but does the situation look like we might get back to that hybrid sooner than we were thinking?
Yeah, it does. In my mind, it absolutely does. So here's the circumstance, guys. I understand the day that we made the announcement, the day I went out and, recorded my video for the community and stuff, that was looking back at it now, that has been the tip of the iceberg. That coincidentally was the single worst day that we've had. And I made a plea as part of that to say, guys, please wear masks. We started our campaign around here, hashtag we want a season, hashtag we want to come back to school, all those things. The data that we have at this point suggests that has worked statewide. The mask, at about that time, the governor came out with his mask mandate statewide, all those things. It really appears that works. The county data has gotten tremendously better from that point. So we were looking at a several week radical incline. I mean, this looked like the path of a rocket ship, just headed in that direction. We made that announcement, and then literally overnight started to see cases trending down. And it's like they've trended down, actually probably is a more steep trend downward than what it was, on the uptick. It's been excellent in our county the last 4 weeks. We have data for 3 weeks. We don't have our 4th week of data just yet. The health department kind of hedged on that a little bit, said we'd have that hopefully in a day or two. But, we went from way up over 200 cases per 100,000 residents. That's the day we made the announcement. The next day it was at 180. The next day at 147, the next week at 147. This last week's reporting, I think, was 126, if memory serves. So, I mean, we are coming down drastically. If we get under 100 cases per 100,000, I think from what we're able to determine, I think our county would actually go to yellow and not orange. Like, our county has really improved. We are at, we had at one point, I think maybe 6 or 7 indicators in that indicator band. That's what got us into red. And now we're currently sitting at just 2 indicators. And the one is, I kind of refer to it as the free space in bingo, because everyone has the, Adam, what's it called? The
congregate setting.
Congregate setting. Yes, we were talking about it earlier. Congregate setting one, I think, to my knowledge, every county in the state has the congregate setting indicator. The only other indicator that we have is the number per 100,000, and that has trended down very, very rapidly. So feeling really good shape with this in my mind. So Dave, you're right. We've put it out to our community. We prepared our community. We prepared, our students, our staff, everybody for the virtual start. That seems to be the responsible thing to do at this time. But I'm kind of looking at, I don't know that I'm ready at this moment to make an official announcement, but I'm looking at, in my mind, the very early part of September, without releasing, without putting out there, guys, this is the date it's going to happen. Want to, just have a few more days to look at this and see some of the data. But the date September 14th looks really good on my calendar right now. I think that if things, continue the way they are, I think we're going to be able to give that go ahead here very, very soon. Now, again, I want to preface that by saying, for the fourth, fifth time, the idea of fluid and flexible, understand that 2 weeks from now, we could, see an uptick, and then that situation changes. We're about to take a vote here on athletic participation. I don't want to presume to know how that goes, but assuming it were approved, who's to say 2 weeks from now that I don't pull that back? Any of these things are possible, but the way things look at this moment right now, I would see us being able to return to school in our hybrid model very soon.
Thank you.
Mm-hmm.
Okay, let's see where we're at. Okay, is there any other questions or comments?
I don't have any other questions. And if no one else has any other questions, I do have just some comments.
Okay.
I got one quick question. Concessions, I'm assuming they would be closed under the governor's order, but I don't want to, assume too much. I wanted to ask you guys real quick.
Right. That's yet to be determined. We do know this, that if there is concessions, they would have to follow all the guidelines that restaurants would, like that would be a part of it. We believe that that concessions are going to be permitted per the governor's order, but that's going to ultimately be a league decision if we're going to proceed with concessions or not. So don't yet know, but if we do, it's going to have protocols just like anything else.
One more question, Mark.
Yeah.
When we make a change, I know there can't be a much of a notice if we got to shut back down.
Right.
But is there a timetable that you notify the community that in 14 days we're going to open back up, or so they can make arrangements, with employment or?
Yep. Wally, I'm so glad you brought up that question. And exactly, you kind of used the number there that I like too, the idea of 14 days. So, for anybody out there in the community listening, and I'll probably, guys, follow up with a video to our community here, kind of explaining, whatever happens as course of this meeting. But, and of course, when we would transition back, I would do that, make sure the community is aware. But when we are transitioning from a less restrictive model to a more restrictive model, my timeline for decision shrinks drastically. And what I mean by that, so if we're back in hybrid and cases uptick very quickly, Angie calls me and says, hey, we've had a massive outbreak, that could lead to a shutdown in a very short order. We can't be very patient when we're moving from a less restrictive model to a more restrictive model. Safety has got to dictate that we move more rapidly there. Now, again, I'll try to do everything I can to give you as much advance notice as possible, but understand that a circumstance could exist where, you find out on a Thursday that we're moving to a different model on a Monday. That could happen. However, when we have the ability to move from something that is less restrictive into when we have the ability to move from something more restrictive, i.e. our full virtual model, into something that's less restrictive, i.e. our 50% model, we do have the flexibility to do that with a little bit of patience and a little bit of advance notice to the community. So I guess what I'm saying right now is maybe put a little mark on your calendar for the 14th, and then here in the not too distant future, I might come out and confirm that as a date or whatever that date's going to be. But yes, we can definitely be a little more patient and give people, because listen, that's one of the big things. And I hear people loud and clear. And again, I'm dealing with this in my own family. We got 3 school-age kids. I get it. It is a nightmare. I totally get it. You don't want to have, these situations. And that was part of the video I released previously. I tried to promise the community, listen, I'm gonna do everything I can to be respectful of your schedules and not just change on a dime. So, with respect to what Dave asked earlier and what Wally's asking now, yes, I think we can look at a return in the early part of September. And yes, I think I'll issue a date that may or may not be September 14th, but we'll look at that here in the next few days and then maybe make that announcement official. But again, prefacing that with, I could say 2 weeks from now, guys, we're coming back to school. And then circumstances dictate as we get closer that, hey, sorry, we're going to have to pump the brakes. So everything that I tell folks, these are our intentions, but I always try to preface that with having folks understand this is, again, a fluid and flexible situation. I try to be patient with these comments because one of the things that we try to avoid is telling our community, this is what we're going to do. And then 3 days later say, nope, we changed our mind, we're going to do this. And then 3 days later, nope, we changed our mind, we're going to do this. And we've kind of seen that movie play out in some situations. And to me, that's undesirable. I don't want to do that to our community. So to answer both of your questions, yes, we can transition. And yes, we can do so with a little bit of patience from the full virtual model into the hybrid model. But I do want to do it sooner than later.
Okay, Amber, you had a comment you wanted to make?
Yes, thank you. So I really appreciate Mrs. Kirk sharing the local data. It really leaves me feeling a lot more optimistic about kind of where we're heading. Obviously I've been watching the statewide and the Franklin County level data and seeing that same positive indication, but it's even more reassuring to see it at the more local level. I wish that all school districts were just given this information, or maybe not to the individual, but in some way, so that we are all better able to make these important decisions, and so that we can see it, very clearly. I think that would be helpful for everyone. So it's really appreciated. Overall, I feel like we're moving towards a place where we're able to get closer to getting kids back in school, which I know all of us really think is important and want to see happen sooner rather than later. And I have a lot of concerns that the contact sport piece is going to negatively impact that or make it less likely to happen. You know, we talked about the last couple of weeks of decline, and knowing that, was it August 3rd, I think, that the announcement to recommend that extracurriculars get canceled or get suspended was made. And so we have the removal of that happening, coinciding with the, you know, decreasing cases. And so, you know, we don't know if that could mean that putting them back together and getting kids out there again is going to then have that effect of bringing it right back up and making us in a situation where we're looking at, you know, not being able to bring kids back in a blended model in mid-September. I think with the contact sports, it's, you know, we've talked about the guidelines of Franklin County and trying to work within those. And with the contact sports, it becomes even harder because, you know, it's literal contact. You can't keep them apart all the time, and you can't wear masks. And so the risk just increases. And if we're going to possibly bringing our students back into the school, are we then also increasing the risk of spreading outside of the community or outside of our school, but to family members and to school staff, if we have students that, you know, come in contact with another school district or another student, excuse me, that's positive, or, you know, so those are all of the things that are playing in my mind. And I've lost a lot of sleep over this topic in general. Yep. I think we all have. But this one is hard because I know it is such a important thing for kids to be able to, that are passionate about sports, to be able to participate, and they look forward to that. And for some of them, it is their motivation. And I see that as a teacher every day. I get that. So I'm really struggling with it, but overall, I really have a hard time deciding that it's the best thing for our students to be able to do that, knowing that we are then increasing the likelihood that we're increasing exposure in our district and decreasing the likelihood that we can bring our students back. So with all of that being said, that's my comments. The motion as it's stated, I don't feel I can vote in favor of. I'm not necessarily proposing an amendment or anything. I'm just saying that I would feel like I could vote for it if it were to follow the Franklin County guidelines, or excuse me, the guidance that is given by Franklin County. And I say that understanding that the data for our district does look different, and that's good, but we know that our students and our staff don't all live in our district, or our students do, but our staff don't all live in our district. Our coaches don't all live in our district. Some of them live in Grove City and some of them live in Westerville or Canal Winchester, areas where maybe it isn't the same or as low as ours. And so that the overall Franklin County picture, while yes, only one data point, I think is still important to look at and to consider as we make our decisions, because unfortunately we aren't just in a bubble where we can say, here we are and we're safe here. And the more we expose and add to our students going out and playing other teams and contact sports, that lowers that chance. So
yeah, I'd like to make, oh, I'm sorry, I thought you were done.
No, I'll stop there. Thank you.
I'd like to make a comment. Yeah, I know what it's personally like to get a phone call from a child informing me that she and my granddaughter tested positive. And you know, it's not a good feeling at all. Something that the governor spoke about yesterday was and we're talking about a contact sport, and along with a contact sport, we have a tremendous number of band members that are just as dedicated what they do may not be a contact sport, but it's just as rigid as any sport I've ever witnessed. If they're not on that field, if they're not participating in a sport or a activity, where are they? My daughter wasn't at a contact sport when she contracted it, nor my granddaughter. If one thing is that when you're committed to something and you're committed to a team effort, that be any kind of a sport or band or whatever, and you know that if you're not responsible, if you go places where you shouldn't be going without protection, that you are going to possibly infect the thing that you love, the thing that you participate in. And it, you know, I always talk about life lessons. And, you know, a lot of kids are learning some tough lessons with our graduation, the way it went out of school. Well, you know what you got to do? You got to follow the rules. And you're not, the chances of getting it in a contact sport, you're picking it up somewhere else. Your teammate, you know, it's just personal responsibility. And that's what education is supposed to be about. It's not only teaching the 3 R's, but responsibility. And the reason why I support getting them back is that that's all part of the lesson, is responsibility, not only to yourself, not only to your family, but to your community, your teammates, your band members, your schoolmates. We all see the pictures on TV where kids walking through the halls with no mask on. That principle should have been let go. We're going to reopen with responsibility, and this is just part of it. We're going to reopen with the intention of staying open. And, you know, my daughter, because of, you know, I got 14 cents in my heart. My daughter was afraid that she'd given it to me, and she bawled because she thought she might have gave me a death sentence. She got it at a little kid's birthday party by a person that probably shouldn't have been there. That was irresponsibility. So we're teaching responsibility, and that's why I'm voting for it. If they wasn't on that field, if they wasn't practicing with that band, if they wasn't twirling that flag, where else would they be? They could be hanging out somewhere and contracting the exact same thing. This way, it's more structured and it's teaching responsibility to each other. I'm going to shut up now.
Okay, thank you, Mr. Ober. Any other comments on this motion?
Let me just add one little bullet point I missed when I was trying to go through my thoughts here. The one thing that concerns me the most, and I know you, Mr. Tyler talked about the doctor speaking about the heart, you know, issues possible with a child contracting COVID, and it's the long-term effects that we don't know about with this being a novel virus and not knowing. You know, we think it doesn't affect kids as harshly, and that's what we've seen, but we also there was data that they didn't spread as much among children either, but now there's contradictory data coming out with research studies showing that they may in fact spread it even as quickly as adults or as much as adults. So with the information changing, these decisions could have such long-term effects and implications. And so I think we need to keep that in mind too.
If I could just interject for a second. Mr. Fitzgerald, I know that we've all talked about the 15 minutes of contact that have to occur, or that's kind of their standard model of you have to be in contact with that person for 15 minutes for you to be able to contract or something like that. Or can you speak on that as far as like how that happens during a football game? Are they, what is that? Because I feel like there's not that type of contact continuously. And I know there's been lots of different discussions on that throughout the health community. So a play lasts for a minimum or what, 5 seconds, they're back apart. I mean, I don't know if that's something that can be cleared up to ease Amber's mind just a little bit. I know where you're coming from, Amber, and I know her concerns, and I appreciate them. And I do understand your side of it. I just want to make sure that anything that would help ease a little bit of that, we're not going to make it 100% complete. I get that. And that's fine. That's not my job. I'm just here to give data, but I want to make sure that if we have other information we can share, that we do that if it's something you're able to do, Mr. Fitzgerald.
But you said it pretty well. That is one of the things people are saying, that you have to be in contact within 6 feet for 15 minutes. That does not happen in football or soccer or any of our contact sports. For 15 minutes straight, if that's the benchmark they're using, that does not happen.
Yeah, one thing I have heard that, and one thing that I thought about with that is that, when we think about a guideline of, notification for contact tracing or for documentation purposes to try to keep, let people know to be more vigilant, et cetera, there has to be some standard, because it can't just be like, oh, I walked past this person and on the sidewalk, and so therefore I now have to, quarantine for 14 days. So there has to be some standard. I get that, but really it doesn't really mean anything. I mean, essentially, we don't know scientifically that 10 minutes is really what is needed, or 15 minutes is really what is needed. I mean, theoretically, someone could cross paths with you on a sidewalk and sneeze at that moment or cough at that moment, and that could be enough to infect someone. And so it does help that they're not continuously engaged in contact, but it also kind of raises the concern that, if they do get together for only 30 seconds, they could very well still spread the virus in that 30 seconds. But then if the quarterback, or I don't know, football terms, whatever, if a player was in contact with one of our students and coughed, sneezed, otherwise infected them, but wasn't in contact with them for 10 minutes, and then the next day came down with symptoms, and then 2 days later tested positive, would our student even be informed that they were in contact with a person who was positive? Probably not, because they don't meet that definition of close contact.
But that's where, Mr. Fitzgerald, correct me if I'm wrong, that's where you guys will sit down in the league to set up those guidelines to make sure that you're contacting each other of any.
I hope that definitely is important.
I agree with you, Amber. That needs to be at the forefront, that when they have their meeting. And I believe these guys, look, they want to play. They feel it's important to the kids and the community and for the mental health of these kids too, a lot of that. So I'm confident in tasking, as Mr. Tyler did, Mr. Fitzgerald, with those other coaches and other athletic directors, that they are going to come up with a model that is going to say, hey, you know what? Bobby was sneezing. Now he's got 104 fever, blah, blah, blah. Let's make sure that you guys understand this kid had this and we're here. So that does put the responsibility back to that we are tracing that and we're keeping action with our kid. And then what that is, maybe a reporting piece for the coaches you may assign one of your assistant coaches that goes, hey, Bobby's sick. He's been out for 4 days. He's got a fever. Bobby's going to get tested. Okay, we'll contact Amanda and tell them Bobby, linebacker number 45, tested, and those kids. So I think it has to be, however you do this, I feel like it has to absolutely be a group effort with all teams involved in this league. And I think that you agree with that, Mr. Fitzgerald, that is something you guys are going to come together and do to help ease any of the fears that you have.
Absolutely.
Am I correct?
Absolutely.
Guys, I don't want to play like, worry Olympics, like, who's more worried about things. But, from my chair, obviously I'm the guy making the recommendation. And I'll tell you, this is, again, not asking anybody to feel sorry, but my God, this has been the hardest thing I've ever envisioned in my life, having to do with, having a great deal of responsibility over the safety and welfare of kids, which we have on an everyday basis in school. But this is obviously a highlighted situation. This is bigger. And ultimately, I mean, just every conversation I'm a part of with the health department, I mean, they're just very candid with us. It's like, listen, there is nothing you can do, including being fully virtual. Okay, there is nothing you can do that does not involve risk. You cannot wrap your student body, your staff, anybody in a bubble and prevent them from getting it. There's certainly precautions that can be taken to help, prevent community spread, those kind of things. But then it really just becomes, this judgment factor on what is acceptable risk. And that is such a difficult thing to consider. That's such a, again, moving target. We're playing with, difficult and, again, fluid information at times. One of the comments, Amber, that you made that I want to clarify from my part. So I am not suggesting in any way that we go away from looking at county data. I very much look at county data, look at that consistently, because look, if our little, bubble here in our school district looked great, but the county was trending upward, yeah, I probably am not making this recommendation. So we have a county that is trending. The county as a whole is trending downward at a rapid pace. Full disclosure, I would have loved to, because, Amber, you mentioned you'd be more comfortable if we were in orange or yellow, to make a decision like this. I would have loved to waited another week on this decision and said, well, let's just kick this down a curve and let's look at this next week. Because, every indication is we might even skip, we might skip orange straight to yellow. Like, I mean, it is really trending positive in our county. There's some great things happening. But then again, tomorrow people can stop wearing their mask and things go straight up. You don't know. But, from my perspective, it is the reason, and I'm very sorry, board members, that I've got to put you in a position like this. I hate to have to put you in a position to make a difficult decision like this. I hate to be in a position to make difficult decisions like this myself, but that's just, the hand that we're dealt. The issue with that relates right now to having to do this with sports is that it is such a time sensitive thing. That was one of the reasons to declare this an emergency meeting, because truly, if we are going to participate, like our coaches will, I'm looking at my clock here, it's 1:10. Our coaches will 2 hours from now begin this participation in order to get ready for our first competition. Some sports have a little more flexibility, others don't. So it's very difficult. I would have loved, and I thought about that, do I just say, guys, we're going to wait and make this decision next week or 2 weeks from now? Angie's data really helped me feel more at peace with it. Looking at it in terms of what the governor said to me last night, really made me more at peace with making this recommendation. We have a county trending down. Our local data looks good. The governor kind of blessed that decision-making protocol, made me feel better about it. But full disclosure, I would have loved to have been orange or even yellow when we make this decision. It's just, we don't have the luxury at this time of time. So the governor did release yesterday. This was one of the things that we were all very surprised about, was the idea of being able to do something in the spring. Okay. Full disclosure, if the board votes no on this, absolutely, Ryan and I are going to pursue, looking at this task force and seeing how we can participate in the spring. He and I, just realistically understanding how this is going to work, especially with our local opponents, I know that there's going to be an effort to make a spring season possible. I'm not seeing that as a reality. I'm not saying it won't happen. I don't know how. COVID surprised me a bunch of times now, but I don't know how that's going to happen. If there was an ability to just say, well, let's let our kids play in the spring. It's just really a situation. And again, my apologies to the board. I wish I didn't have to put you in a situation like this to make difficult decisions. But this one it's a time sensitive thing. It is not for every one of our sport, but for certain sports, we're kind of at a now or never position. I just wanted to clarify that, because, Amber brought up that point about being orange. I would have loved to. Believe me, Ryan and I discussed this, my administrative team and I, we discussed this at length. But it is a now or never thing. That's where we're at.
Okay, any other comments or questions?
I would like to speak a little bit about it if I could. Like I said earlier in the meeting, I think I was talking to Wally before we come on, or just I'm trying to uncover notes, and I mean this doesn't go back to 2 weeks or 2 months for that matter. It goes back pretty far back as in the last school year. And last school year, what was he trying to do? The last thing we tried to do was give an opportunity for our seniors and to do something special as far as a graduation at that point. Nothing was done. We didn't jump into any conclusions. It all come with much thought and the hard work by a lot of people. I think we pulled that off very well. And now, throughout the summer here, it's worked. We're looking at a next set of seniors and children below to make decisions for. So none of it's gone without a lot of thought and effort by a lot of people. I'd like to go out and just first of all say thank you to, the governor's office, really, for giving an order yesterday. I think a lot of us were waiting for that guidance to be able to make a decision that needs to be talked about there. I know the countless hours that the three people that have spoken, Angie, Mrs. Mayor Kirk, I know she spends a lot of time. I've had conversations through her throughout the village through this whole thing. I know she works tirelessly. She looks at everything she can. Mr. Fitzgerald being on a regional board, state board, and working with his own league and through our administration, I know how many hours he's put in. And Mr. Tyler, we all know how many hours he's put in. Mr. Collier as well. I mean, his input and the hours he's put into it. It's just, I have confidence in these people and their decisions and their recommendations. So, the community, I believe, looks at this as a mental health issue as much as an athletic issue. I do firmly believe that. That was stated yesterday with the governor. He said that, and the lieutenant governor, I believe they both spoke about that being, the mental health part of this is weighing on a lot of people in my own household. So I know it's probably in each one of your households somewhere it's come up. So nothing's been taken lightly. I guess that's my point to be made. And, I know ultimately it's a family decision. Let's be honest. The families have to make these decisions for their children first and foremost. That's the way it happens before they go to school every day anyhow, whether it's virtual or hybrid or back full. Decisions have to be made in the household first. So, that's never to be taken lightly. That's what we should be respecting foremost, I believe. So, that moving forward, once they're there and once they're with our people, I believe it was stated by Mr. Obert, there's a lot of respect and things that go along with being on a playing field, whether it's in the band or as a player or a cheerleader. You have coaches. And I hope to think that, and I know a lot of our coaches mean so much to the children that are involved, whether it's a cheerleading advisor or band director, whatever it may be. I see it all the time. They talk about, in my own business, they talk about the teachers that make differences in their lives. Teachers that are in there, they're coaches as well. They make an impact every day, and they're going to turn these people into leaders. They've become leaders, a lot of it through athletics and or band and drama department, whatever it may be, all due to the people who are in our school districts helping them. And I just keeping them away from them, not having that type of positive leadership is tough on me. I have a big problem with that more than anything. I have, like I said, a lot of respect for our coaches. I know a lot of them personally, and I know the impact that they make on our kids. So I know Wally stated some of the same issues on this topic. That really weighs hard on me on the whole thing. And I don't want to underline anything with the health or the science or anything that has to do with it. I know the local data really means a lot to me. Angie, thank you very much for that, because I took that was the one thing I took from the doctor's statements yesterday, is that your local data means everything, really. I hope to think that our coaches will, and our administration will hold them to the children to what they're supposed to be doing: wear their masks, everybody be safe. And then like I've stated at the last board meeting, there's to do with all of this, and like I told Mr. Tyler a while back, is there's more questions than answers to this. Obviously, we'll be chasing this for years and decades to come. So all we can do is go by the recommendation and the experts and what we believe in our own hearts to be the right decision for our community. So with that, I personally am all for moving forward with what we need to do as far as our children playing in athletics. All I can do is speak from my own heart, and that's kind of like what I try to do there. That's all I can really say at this point. And I know there's data and stats out there that will work either way on this upcoming, but this is the way I currently feel. And just wanted to get those statements out at this time. Thank you, Mr. President Schutte.
Okay, thank you. Any other comments? Hearing none, I need a motion for 4.1.
We are having motion in a second. Yeah, we are having motion in a second.
In a second. Okay, I'm sorry.
Okay.
I'm
Roll
old.
call.
Yes, call the roll.
Mr. Obert,
Yes.
Mr. Sewell,
Yes.
Mr. Dahmer,
Yes.
Mrs. Clark,
No.
Mr. Schutte.
Yes. Okay, moving on. Do we have any more tabled items?
No, we do not.
So I need a motion to adjourn the meeting.
So moved.
Second.
Any questions or comments?
Oh, thank you, guys. I really appreciate it. Amber, thank you for always being engaging and understanding, what we're doing too. And I appreciate all of you guys. And I want to continue to be able to work together, not just as the mayor, but I work here too. So I want to make sure that whatever I can do for our district and our community, and Amber, if you have questions that you want answered, you have my number, please contact me and I'll try to guide you through the best I can with answers. That goes for any of you. So I really appreciate all of you. And I know this is a hard time for all of us, but I think we're just trying to make sure we're trying to do the right thing. And we all have to figure out what that is in our conscience. And I appreciate you all, just so you know that. I thank you.
And thanks to Ryan and Angie, and I want to thank our board members again. And my apologies for the obviously short notice to this. We didn't know that we're going to need this until after the governor spoke. We kind of suspected, and gave as much notice as was possible. But this vote now allows our athletes to move forward, and Ryan will make that announcement. We'll practice this afternoon. So thank you for the short notice. I know at least one of you gave up a fishing trip for it. So thank you for that, guys.
I just want to say, I just don't want to, there's something that's been sticking with me during all this. And it was a quote actually from OSBA, Kim Mower-Smith, who runs our liaison program. And I listened to her, and the three words that she basically threw out, I believe I stated last time, was be respectful, supportive, and positive through everything. That's, none of us here fully know what's out there. Like Mark said, it's a serious moving target. So thanks everybody. Appreciate it.
I think she just stole "Be good, try hard, have fun." It's the truth.
Yeah.
I would like to say thank you to Mayor Kurt and Mr. Fitzgerald and Angie. I respect that vote. I respect your vote, and I understand why you voted that way.
Absolutely.
And I appreciate it.
Thank you, Mr. Obert.
That's it.
Any other comments or anything? If not, I need a motion to adjourn the meeting.
We already got that in a second. We just need roll call.
Did we get a second?
Yeah, Wally.
Okay, didn't hear it. Sorry.
All right.
Call the roll.
Mr. Obert,
Yes.
Mr. Sewell,
Yes.
Mr. Dahmer,
Yes.
Mrs. Clark,
Yes.
Mr. Schutte.
Yes.
1:22 p.m.
122. Thanks,
Yep.
guys.